Welcome everyone to the Department of Veteran Affairs webinar series. Today we're discussing moving into aged care. We at OPAN would like to acknowledge and pay our respects to the Ngunnawal people, the traditional owners of the land on which we are and filming today. We would pay our respects to elders past, present and emerging. This webinar is just the sixth in this series. It's an educational suite raising awareness of DVA services and informing DVA clients and health professionals of the services and supports for older veterans and their families. Today, we aim to raise awareness of DVA programs and services and support older veterans and their families, including assistance navigating aged care services. We hope to inform DVA clients of support that DVA can provide on an ongoing basis to their families and transition into respite and permanent residential aged care facility, and providing an understanding of the Charter of Aged Care Rights and empowering support of advocacy and advocacy services. My name is Marie Montgomery. I'm your facilitator today, and this webinar is brought to you on behalf of the Department of Veterans Affairs and OPAN, the Older Persons Advocacy Network. Let's come across to some of the amazing panellists that we have with us today. I'm going to go to Shane Burke. Shane is currently in warm Brisbane, and he is the aged care liaison, part of the aged care team and the income support branch, clients benefits division. Welcome, Shane. Thanks for joining us today.
Thanks, Marie. Basically, Marie, my background, I joined Veterans Affairs 10 years ago in the income support role. So basically granting pensions, updating pensions, etc. I joined the aged care team on 1st of July 2014 in line with the introduction of the new aged care system. My role essentially is to troubleshoot any issues that veterans may or their families may have in the aged care world. I've got to say, really enjoy the role, really satisfying, and it's good to know that we can make a real difference to our veterans.
Yeah, you're absolutely spot on there, Shane, and I imagine you'd be a very busy man. So thanks for letting us know a bit about your background and your passion. That's fantastic. So we're going to move across to Julie Brumby. Julie, you're the Welfare Officer and Welfare Advocate for Veterans Support here in Canberra and Belconnen. Tell us a little bit about your background and I guess why you're so passionate. We've had a chat and you are.
I am. So my background began in teaching. I enjoyed working with children, but after a while I decided I wanted to branch out into social welfare. So I got my postgraduate in that. From there, I sort of worked in the welfare area, but it's only been the last 3 years that I started working with veterans. And the passion comes from recognising the vulnerability of some of our clients and the difficulty in transitioning from their home to another home, which is really tough.
It's understanding that vulnerability is so important and so rewarding.
It is very rewarding.
Yeah. Excellent. Thanks so much, Julie. And then across to Roger Munson. He is with Advocacy here in Canberra. Roger, tell us a little bit about your background and I guess also a little bit about Advocacy.
Thanks, Marie. I grew up in Ballarat and my first role was as an orderly in an aged care geriatric hospital. So I began my career, if you like, in the aged care sector. I also continued to work in places where I was supporting people, helping them to have their best life. Worked in the public service as a human resources officer, staff development and training and welfare. And then went on to be an Anglican priest for a while, again supporting people and sometimes standing up for them in the community, and on to being a social worker. And that role's brought me to Advocacy, which is part of OPAN. And in that role, we work as advocates to help people to achieve their goals, to stand up against abuse and to have the best life they can as well.
It's a powerful role, and you have an excellent collective background to bring into it.
Yes,
So thank you for joining us today. You have an opportunity today for Q&A. Please send us your questions and they'll come through to us, and we will endeavour to answer them throughout the session. They'll come up on my phone, so that's what we'll be looking at. Okay, so let's check out what we're looking at today. Step-by-step guide to the aged care journey process. And it can be a bit convoluted at times, but it's so important to have that conversation. Points to consider when finding a aged care home. Just like you'd find any home, it's so important to have a look around and have a really good think about and be prepared. Shane will tell us some financial guidance and means testing and what it means to you and your family. And Open Arms, we look at Open Arms program and how important it is for support. Lastly, Roger and I will have a chat about advocacy and the Charter of Aged Care Rights. OPAN and the Department of Veterans Affairs have created an excellent explainer video which looks at all the services available to yourselves. We might just actually have a quick look at that now.
As your clients get older, they may require additional support and services to help them live a full and active life. This may include support for carers and support from providers to help your client with living at home independently. Your client may need assistance in unexpected circumstances, such as after hospital visits or on an ongoing basis. And your client may need assistance when transitioning into permanent aged care. While the Australian Government offers many services to assist older people, there are additional services available to eligible veterans and their families, provided by the Department of Veterans Affairs. These services are easy to access and often at no or low cost. Those eligible to receive these additional services include most veterans, serving and former serving members of the Australian Defence Force and their families. And services available vary depending on what type of card your client is eligible for. While some veterans are aware of their access to these services, there are many that aren't. If you think that your client may be eligible, you can encourage them to apply online using their MyGov account. Or they can contact DVA directly on 1800-VETERAN. The Department of Veterans Affairs offers a range of services aimed at helping those eligible to continue living independently at home for longer. These services include domestic assistance, providing basic support around the home, such as help with cleaning, washing, shopping, and more. Personal care, for assistance with some non-medical tasks to help you stay independent. Safety-related home and garden maintenance, to keep your home safe and livable through minor upkeep and handiwork in and outside your home. Additional help can include community nursing services, such as assisting with taking medication, wound care, and personal care. Support and rehabilitation aids, including mobility aids, personal aids and equipment, continence products, and also home modifications. Services include support for carers, for when carers need to take a break. Social assistance, helping your clients stay connected to their community. As well as support to help manage chronic health conditions or support after hospital care. There may be a time when your client may no longer be able to live independently and may require the support of an aged care home. The Department of Veterans Affairs can assist those eligible with a range of services, including mental health and wellbeing support through Open Arms Veterans and Families Counselling, who provide free and confidential counselling, group programs and online resources. Access to aids and equipment, such as hearing tools for when others are complaining about things like TV volume, speech and visual assistance tools, limb supports, prosthesis and more. Medical-related travel for your client to appointments with their GP, specialist and other health professionals. Staying connected to the community, including helping keep your clients connected to ex-service organisations and more. Remember, access to services vary depending on your client's eligibility, and services are designed to complement those already provided by the Australian Government. To find out more about services available to veterans, including more information about eligibility, resources, self-help booklets, or for links through to a local military welfare advocate, visit the Department of Veterans Affairs website at dva.gov.au or call 1-800-VETERAN. If your client is having trouble accessing aged care services, feel like they're being treated unfairly, or if they'd like to know more about the rights of older people, your client can contact OPAN, the Older Persons Advocacy Network, on 1-800-700-600, or by visiting their website at opan.com.au. Their national network of trained advocates are there to listen and assist free of charge. This video has been funded by the Department of Veterans Affairs and is proudly brought to you by OPAN, the Older Persons Advocacy Network.
Excellent video. I really love those characters. They've really come alive. The other source, which is an amazing source of information, are these two booklets. They are produced by Department of Veterans Affairs and are available online at dva.gov.au/AC. And they are a wealth of information, especially what we're talking about today and in all the webinars. So grab a copy of those. Okay, so there are times when we need a little bit more support for complex care needs, or we notice that even though with all the supports and services that are available, we need a little bit more help. And there are many reasons, individual reasons, for entering an aged care home. And finding that right home is so important to you and your family. When we look at aged care journey, there's parallels of the Department of Veterans Affairs, but the Department of Health and the My Aged Care site and services. We've got a quick little My Aged Care video which sort of gives you an idea of the services available. Let's have a quick look at that. It's a very short little one.
My Aged Care is your starting point to access government-funded aged care services. Whatever your situation, specific needs, or background, we can help you understand what types of services are available. From services that help you live independently at home, to short-term care that helps you get back on your feet, to moving into an aged care home when you can no longer live at home. Once you have the information you need, you can call us to discuss your needs and find out if you require an assessment. If you do, an assessor will come to your home for a face-to-face assessment to work out what services you're eligible for. We can also help you estimate the fees you may have to pay and what service providers are available near you. Wherever you are on your aged care journey, My Aged Care can help you get started. Find the help you need with My Aged Care. Go to myagedcare.gov.au or call 1-800-200-422.
Excellent. So Julie, I guess as the video points out as well, there are many steps to, I guess, getting into or getting some aged care services and that journey with My Aged Care. Can you talk to us about the steps involved in navigating that?
Yeah, so My Aged Care basically covers support from home, respite care and permanent care in an aged home. The process is most important. The first step is really important, and that's to talk to your friends and family. Talk to your doctor, work out what the best thing is for yourself at that point.
Yeah.
After you've made that decision, the next step is to have an ACAT assessment. So you ring My Aged Care and they'll do a phone assessment. They will ask some minor questions to see if you're eligible, and from there they will set you up a time to do a home visit. So once the home visit starts, they will ask all sorts of different questions to establish your needs. At that point, you can have a support person in if you want. And then after, you'll get a letter basically saying what you're eligible for in terms from My Aged Care.
Okay, excellent. So the steps we have up on the screen is actually a good way of looking at the, I guess, many different processes along the way. And it's so, as you said, you can get a support person in.
Very important.
Yeah. Roger, can yourself as an advocate, can you assist at all with older people on this journey?
We often receive a request to attend and assist a person through the ACAT assessment. Part of that would be to have some prior discussions so we're aware of the person's difficulties and what they may need to get out of the assessment, and therefore we can better support them during that process.
Yeah, it's important to provide that voice and support. Excellent. So
it's
as we
very
mentioned,
easy to get overwhelmed in that space.
Yeah,
yes.
it is. And often we can come into that space very vulnerable and after a quick incident, i.e. a fall or something like that.
That's right.
Definitely.
So as we mentioned earlier, it's important to have this support and a variety of options to meet the needs of the older veteran and family to find that right home for them going forward. Shane, we talk a little bit more about means testing shortly, but I guess in the initial stages, before even a veteran thinks about finding a home, what are some of the advice, particularly financial advice, that you may provide?
Look, essentially, like everything, good planning leads to good results. If you're a self-funded retiree, a homeowner, you're partnered, any combination of those, and you don't get good financial advice, it could quite conceivably cost you $150,000 or $200,000. All right? Wow. So we're talking big money, so it's crazy not to get good independent financial advice. So let's talk about essentially timeframes. So if you're 5 years out from going into an aged care facility and you see a financial advisor, they're in the best position to advise you on how to maximise your pension at entry and how to minimise your aged care fees. So they can look at ways, if you're a homeowner, as an example, from exempting your home from your assessment. By exempting your home, you might go from paying a $550,000 RAD to not paying a RAD at all. So look, the hardest thing in aged care is that each individual, their circumstances can be completely different. So they really need that top financial advice. And again, I'm going to talk a little later about networks.
Yep.
It's vitally important that if you find a good financial advisor, let your wider community know. Can't emphasise how important it is. As I said, you make a mistake, quite conceivably costing you $150,000, $200,000.
Yeah, it's sage advice. Absolutely. Thanks, Shane. Julie, I guess for people viewing this today, what sort of advice and steps would you give them for finding the right home that would suit them?
Yeah, definitely. So finding the right home is really important. You don't want to make a last-minute decision. You need to be planning for it.
Yeah.
When you're looking for something, it's basically you can look online and see what's online. You can ring them up, have a chat about what they offer, what their services are, what their day programs consist of, because there's lots of that.
Yeah.
You can go and visit them and make an appointment to go and visit them, and maybe take someone with you at that point so that they can feed back the information that you want to know and help ask the questions.
Yeah.
Another really important one is word of mouth. So people who are already living in the homes that you're interested in, whether it's someone you know previously or even the people that are there, have a chat, see how it feels.
Yeah, word of mouth. So powerful, isn't
Very
it?
powerful.
Yeah. Excellent. Shane, you provide many presentations to veterans around finding aged care. What is your specific advice for a veteran, I guess, in regards to finding the right home?
Look, basically, information's the key. Now, veterans are ideally planned, their wider community are ideally placed to use their networks to find out information. And as I alluded to earlier, if you get a good aged care, find a good aged care facility, you find a good financial advisor, let your veteran organisations know. Now, the types of organisations I'm talking about, your RSLs, your RSL sub-branches, ex-service organisations, and like Roger, your advocacy groups. So if you're a member of any group whatsoever, ask questions. You've got someone that's gone into aged care. What was it like? Was it a good facility? So once again, it's all about gathering as much information as you can to make the best decision for yourself.
Yeah, absolutely. It's gathering that information and having that conversation, particularly with ones you love and trust. So is there a checklist, I guess, Julie, for veterans and their families?
So DVA, if you go on their website, they have information about moving into residential care. There is a website called careguidance.com, and that actually has a specific checklist that you're looking for.
Okay, that's fantastic. That's on the DVA website.
No, it's a separate one.
It's a separate
careguidance.com.
Careguidance.com.
Yeah.
We also have a few questions here that would be really great for veterans to ask. So things like, how will you assist me to access health services that I need? Or are there any extra services that you can provide and at what cost? And I think it's really important that veterans possibly take a list like this with questions that they've sat down and really thought what was important to them and their families, particularly veteran-specific activities.
Absolutely.
Yeah, fabulous. Thanks, guys. So previously in the webinar, we reviewed was residential respite care. It was a great webinar, some wonderful panellists on that as well. Julie, what is residential respite? We get a lot of questions about this. And can a veteran and family get care assistance? I guess a little bit more information about what is residential respite.
Yeah, so residential respite consists of going into a home or a care facility, whatever you want to call it, and taking time out from their carer, or even if they're living independently, they might need to go and take some time out where they're cared for. So respite is looking at giving the break, giving them time to be cared for a while.
It's a great acknowledgement of the carer and the role that's
so difficult sometimes.
It can be. Okay, so where does residential respite take place? And can a veteran and family, I guess, transition from residential respite care into permanent care? Yeah.
So residential care for respite here is basically most of the homes that have the long-term care as well. There is one specifically for residential care in Western area, so they don't do the long-term care, but the other facilities do usually leave beds just for respite. In terms of long-term care, they may stay there for a month and decide that it's actually better than living at home and struggling.
Yeah.
So in that case, they can transition straight into it, and the actual home will help you do that.
Okay, excellent. We had a question from that particular webinar, and we feel that we could probably answer it now. So it was around the limits and costs and the amount of days, etc. Can you, I think we've got a slide on that one as well. Can you discuss that with us?
Yeah, so effectively DVA will pay for 28 days respite per calendar year. In that, if they're also getting home care help, the 24-hour period in respite would add up so quickly. So it's actually counted, so it might be one 24-hour period will be counted as 7 hours when put together with home care hours. So that's how they work that one.
Excellent. Thanks for that clarification, because it was an important point. We touched on the importance of financial guidance prior to any contractual agreement earlier with Shane. I'm going to go across again to you now. What does means testing whilst receiving the DVA pension mean to veterans and their family?
Essentially, when someone either takes up a home care package or enters permanent aged care, an assessment is done. Now, it's called, for permanent residential care, it's called a means test assessment. So basically, we capture their income and asset information at entry, and that helps determine the types of fees they pay. Now, the reason DVA is involved in the aged care process is obviously we pay income support pensions, income support supplements and aged care pensions to our veterans. So we hold that information anyway. So once we do the assessment, that information goes over to Services Australia and then they set the aged care fees.
Excellent. Thanks for that, Shane. And I guess also we wanted to talk a bit more about the assets and additional forms that information that you feel that DVA veterans would need to have.
Sure. Now, when you come to do your means test assessment, there's various methods of doing that. What I basically advise is if you are thinking about going into care, call DVA and update your income and assets. Once you've updated your income and assets, it cuts down on a lot of the paperwork. If you're a self-funded retiree, as an example, you will need to fill in an SA 457, which is a 28-page form. If you're a pensioner and you've updated your income and assets and you're a homeowner, you only have to fill in an 8-page form. So vitally important, you keep DVA up to date in regards to you providing the income and assets. Once you've done that, the rest flows through reasonably simply.
Okay, and to let DVA know, that number is 1800-VETERAN. Is that correct?
Correct.
Excellent, thanks Shane. So that key message is keeping DVA up with your assets. Lovely. So we have a lot of questions again around fees, and I know this is vitally important information for anyone considering aged care, and it can be quite convoluted. So Shane, tell us, can you run through that fee structure for aged care?
Yeah, sure. As I said, essentially, when DVA do the means test assessment, essentially there's an income and an asset test involved. Now, let's say, for example, you're considered a high means client. That means under the income and asset test, you've basically got assets over 171,000. And essentially you're considered high means, so you've got to pay the cost of your bed. Now that cost of your bed is called a refundable accommodation deposit. In addition, you'll pay what's called the basic daily care fee, which everyone pays, which is 85% of the maximum single rate of pension, which is currently $52.25 a day. In addition, a high means client will pay a means tested fee based on their income and asset level. So there's three components to a high means client. A low means client will pay the basic daily care fee and an accommodation contribution. And essentially, when we were talking about financial advice before, it's essential that you get that good financial advice to get the best possible outcome you can in regard to paying aged care fees.
Fabulous. It really is important to have that conversation early, isn't it? To really, I guess, look at your assets, talk to your family about what you want, shop around for the home, understand my aged care. So there's quite a lot involved, isn't there? So I think the advice take home is be prepared, have that conversation.
Absolutely.
Excellent. We've had Jim previously in webinars. Jim has followed us through and has had quite a few services through the Department of Veterans Affairs. Sadly, Jim is now experiencing deteriorating mobility and he is moving into an aged care home. He's actually found a really good one, he and his daughter Kate. But when they arrive, they're asked about the Charter of Aged Care Rights. Roger, can you tell us a little bit more? And I have a little booklet here, and I'll bring that up. Can you tell us more about the Charter of Aged Care Rights?
Thanks, Marie. The Charter of Aged Care Rights is a very important document because Jim will know that he maintains his rights within an aged care home. So when on signing up, he knows that he has the right to have his voice heard, that he knows the right to be consulted about the services he receives. He knows he has the right to maintain his consumer rights. He knows he has the right to be respected if he has a cultural and linguistically diverse background, or if he's gender diverse, that he is supported in that, is to be supported to have the social needs that he has to be met in the space. And he also has the right to be consulted on the medical stuff with his doctor and that. What we find sometimes is that people tend to talk to other people rather than the person who's resident in the place and should theoretically still be in charge of their own destiny. So they might talk to the enduring power of attorney or the doctor might just talk to the staff. The person should always be included in those situations whilst they still have capacity.
Absolutely. They're at the centre of all care, aren't they?
Yes.
Yeah. So the Charter of Aged Care Rights booklet is available. There are 14 rights and they're very powerful sentences which are basically human rights and I think they're fantastic. Excellent.
Yes, and an aged care facility must give you a copy of that. And we, as part of our education, also assist residents to remind them of the rights that they have under that facility.
Fabulous. So we chatted briefly at the beginning, Roger, about advocacy and advocacy support. So can you tell us a little bit more about that really important role of advocacy for the older person and the older veteran?
Yes. We work with people who often find themselves in a difficult situation where they may feel powerless or their voice is not being heard. So we enable them to be set it up so they can say what they need to be said and to be heard by the people they're talking to. And that's a very powerful thing for a person to feel that they've been listened to. If they don't feel able to do that themselves, then we can be the voice. We can speak up and put their point of view to the organisation. The other thing as an advocate, because we're there in support, often people who don't speak up because they genuinely feel they might be reprisals if they do, then we're there to help feel that they're okay to say this or for us to say it without fear of reprisal. So that's a very key point. So advocacy often takes the form of what's happening. Family might be doing the wrong thing. The aged care facility might be talking to the family instead of them. They're concerned about not having the right equipment. They're concerned about their privacy. They're concerned about neglect or abuse from staff or family. These are all the things that we often find ourselves involved in. The biggest one we find in aged care is still financial abuse, where people take advantage of the older person.
It's a big issue, isn't it?
Yes, it
is. Absolutely.
And one of the other things we find with aged care facilities, people often talk to us as well about the suitability of a place.
Yes.
One of the things as an organisation we're often involved in an organisation once sanctions have been put in place. So we can advise people when that occurs, and that might give them pause about whether this is a suitable place for them. That's right.
For the viewers, can you explain very briefly what sanctions is?
Yes. So the Quality and Aged Care Quality and Safeguards Commission, they go around and do inspections in aged care facilities, and they have a checklist about the quality that needs to be met by each facility. And if they're not meeting that, they give a certain amount of time to rectify that. If they still don't, then sanctions are imposed. And the basic penalty for the aged care facility is that they lose the ability to bring in new residents for 6 months, which is quite a significant one, and does prompt very quick action. They usually bring in consultants to help them put in place the supports and the care that's needed in order for that facility to provide the service that they should be.
Yeah. Excellent. Thanks, Roger.
No, right.
Such important information. Julie, as a wellbeing advocate, and what is your supportive role, I guess, specific to veterans?
Yeah. So it's a very positive process for us, and it's walking the client through that process where they need support and when they ask for it. So I can, if I'm asked, I can actually attend. I can support them in the ACAT assessment. I can be there if they want that. I can attend any of the homes with them or make phone calls with them. I can attend any meetings they have, and often I can be the scribe for information that they'll forget, like any of us would when we're under stress. And then sort of once they're into a home, they're happy, we can visit them if that's what's required.
Fabulous.
So it's an overall picture.
It's such an important role. And another important program, which we haven't yet chatted about, is the Open Arms program. We have a little video that we're going to, I think, discuss or watch, but Nick, do you want to tell us a little bit about the Open Arms program?
Yeah, Open
Julie?
Arms is a counselling program for veterans. Classified as a veteran, you only need to be in service for 1 day. So it's open to every veteran. It's not only the veterans, it's their partners, their children. They do a combination of counselling or family counselling or partners counselling. So there's a lot of support out there for that. They also do training and education, both for clients and for professionals. So it's keep your eye on that because that's very important to watch.
Fabulous, good. And the video is available online, but we're going to be watching it in the next webinar. So that brings us to the questions, and there are quite a few coming through. So, Julie, can veterans take DVA provided aids, and I guess that's like walkers or wheelchairs, with them into their aged care home? Yeah,
I mean, obviously you'd need to talk to the home and ask permission to do that, but on most occasions, yes, you can.
Okay, fabulous. Good. Okay. I'm just going to go across to Julia again. Sorry, I'm trying to read them as well. When a veteran is diagnosed with dementia and no longer able to make decisions or losing a degree of capacity, and if family supports are not in the picture, can a home care package provider advocate on their behalf? That's actually a very loaded question. Yeah. So do you want me to ask it again?
Yeah.
So we have a veteran who has been diagnosed with dementia and has lost some capacity, and they're asking, and has no family support, can a home care package provider advocate on their behalf?
It's unusual to do that. It's more likely that they would turn to an ESO, Wellbeing, someone like me, who can then talk to the organisation that they want support from.
Yeah.
So it's more likely to be someone like myself
or
even Roger.
Yeah. So it's a funny question.
It is.
And very much seek advocacy support.
Absolutely.
Either with veterans or in your local area. There are 9 across Australia, Atticus here in Canberra. Okay, Roger. Because of COVID-19, and this webinar is during that COVID phase, many aged care homes have restrictions around visitation. Is it possible to view an aged care home during those restrictions? And I've put you on the spot here.
Yes. It's very limited because the main focus of the facility is to protect the residents from any chance of infection, and so that would be very limited. So I would say that the answer would be no, but most facilities do have some online photos of the facility, so they can at least get that information.
There's also the provider tool as well on the My Aged Care site, so that gives you a little bit of a guidance, particularly around cultural diversity and those sorts of things. That's
very true. The My Aged Care is quite clear of the diversity of cultures that they support, and that varies in Canberra as well.
Yeah. So I would definitely ring the facility first before, I guess, attempting to go and see. But definitely word of mouth and, have a look online. Shane, where can people get further help to understand costs and fees?
Once again, look, My Aged Care is a really good site to have a look at it. If they're a DVA client, by all means, only too happy to have a chat to our clients, and that's why I see it as really important to have these sorts of meetings and to get that information out there. So call us, and we can talk you through it.
Fabulous. And you're really right there, Shane. The My Aged Care website has also a fee estimator. Do you know much about that one?
Yeah, look, essentially the fee estimator there uses your assessed income and assets to give you an idea of what your aged care fees would be. And again, it's only as good as the information you put in there.
Yeah.
So look, if there's any doubt at all, by all means, feel free to call DVA. Our aged care team is happy to answer any questions in regard to fees. All right. Now, even though we don't set the fees, we can talk you through the process.
Yeah, and I think it's garnering or getting that information that's so important to try and help us along the way. I've got one last question, and this is to you, Julie. You mentioned it's best to have the discussion and be prepared, as there's a lot involved, as we have seen. But what happens when these discussions haven't been made or planned, and the family need to quickly find a place for their loved one, or the older person needs to find a place for themselves as soon as possible? Who can assist with this?
Okay, again, that would be my sort of an area where you could talk it through. You can ring the homes that you're interested in yourself, and they can have a discussion with you. But usually a Wellbeing Advocate, anyone in that area can actually talk them through what options they have in a hurry, or even accessing a respite care to start with, which will lead into transition to permanent care.
Yeah, and that's how do they contact like yourself?
Yeah, so I'm at the Burke Veteran Support Centre, and our number is 6255 1599.
Okay, cool. Can they find you online?
Yep, we've also got a website.
Fabulous. Yep. Thanks for that, because it's pivotal that people, I guess, leave here today with armed with some information and advice. Excellent. So just a little reminder where you can find support, and you can find these booklets at dva.gov.au/AC. These webinars are also online on DVA, and please don't hesitate to contact DVA at any time, 1800-VETERAN for support, and OPAN at 1800-700-600. Yeah, fabulous. And I'd like to thank everyone for being with us today. It's been a great webinar. Roger, thanks for coming in. So important to have independent, confidential advocacy support. Julie, thank you. You're obviously doing a great job and very passionate about it.
Thank you.
Shane, thank you in Brisbane. You've been a wealth of information, and I'm sure there's some people out there that are going to be taking your advice shortly.
Thanks, Laurie.
Excellent. Take care, everybody, and we will see you shortly.